Good day to all. I'm Sashindra Balakrishnan, lecturer at Medical Imaging Department, KPJ Healthcare University College, Nilai. I'm going to share a brief explanation about CT scan. A computerized tomography scan, also known as CT or CAT scan, uses computers and rotating X-ray machines to create cross-sectional images of the body. These images provide more detailed information than plain X-ray images. A CT scan has many uses, but it's particularly well suited to quickly examine people who may have internal injuries, maybe from the car accidents or other types of traumas. A CT scan can be used to diagnose diseases or injuries as well as to plan medical, surgical or radiation treatment. They can show the soft tissues, blood vessels and bones in various parts of the body. A CT scan may be used to visualize the head, shoulders, spine, heart, abdomen, knee and the chest. The personnel that perform CT scan are called radiographers or CT technologists. Among the roles of the radiographers in CT scan are to prepare patients for CT procedures, operate the CT equipments, provide direct patient care, perform maintenance, and implement continuous improvement procedures. During a CT scan, you will need to lie in a tunnel-like machine while the inside of the machine will rotate and take a series of X-rays from different angles. These pictures are then sent to a computer where they all will be combined to create image of slices or cross-sections of the body. They may also be combined to produce a 3D image of a particular area of the body. Since its introduction in the 1970s, CT has become an important tool in medical imaging to supplement X-rays and medical ultrasonography. Thank you.
Assalamualaikum and good day to all of you. I'm Siti Aisyah Abdul Suhaimi, a lecturer from Medical Imaging Department, SOHS. I'm going to talk about MRI. So MRI, the name itself, this ball contains of the magnetic, circular, and then resonance. So it will be working on with this kind of resonance, or we call it echo. Will be interact and realigned the hydrogen atom inside the human bodies, and it is to be imaged. So we call it as equipment of imaging, one of the equipment for imaging, specialized, which is more details. So that's why it is called as a magnetic resonance imaging or MRI. So in other words, it is a use of the powerful magnetic field, around the ball, and then use of the radio frequency pulses or the echoes itself, so to realign the hydrogen atoms in human bodies to produce an image, and it can be projected or it can be seen on a monitor, with the detailed organs or soft tissue, the bone, as well as other internal structures. And this is not involving of the equipment. Examination will not involve of ionizing radiation or X-rays. So the details of images, it is able to, for the radiologists or the physicians, to evaluate various parts of the body and determine the presence of the certain diseases, and according to the what type of examinations. There will be 3 planes altogether: sagittal, axial, and the images will be in the form of sagittal, coronal and axial planes. So we can produce 3D images altogether. Alright, so we take a look at video. Okay, as you can see here, this is the radiographer positioning. You have to take care of the patients inside the positioning area. So once inside the MRI examination room, okay, the patient is up to us. So we, as a radiographer, we have to position the patient in such a way that the patient will be comfort. You can see the radiographer is placing the immobilization aid inside below the patient's knee, and then be given the belly button so that the patients can call on us if there is an emergency or something to do. We want to talk to the outside. We can hear and they can talk with us, say, kind of communication during the examination. Don't forget the placement of the earplug, because inside the ball itself it's very loud. So this earplug will help to reduce, distract the sounds during the examination. So have to ensure the door is closed. Alright, you have to ensure the door is closed before proceed to the examination. So preparations, you have to make sure that this is the workstation, setting up this is a monitor, so you can see the patients through the large mirror window here in front of you, and this is what you will do. Key in the patient's information. The left side is the monitor. Inside we have the camera inside the bore. Right, so this is planing. Altogether, the three planes, which is the coronal, sagittal, as well as azure plane. Thank you very much for listening.
Hi, I'm Dinesh. I'm a lecturer at KPJ Healthcare University College. I would like to give a short explanation of medical ultrasound systems. The main component of a medical ultrasound system is a transducer, which is made up of an array of piezoelectric crystals. An electric supply is delivered to these piezoelectric crystals. It vibrates and produces high-frequency sound waves, which is known as ultrasound. So the transducer sends ultrasound waves to the human body, and this ultrasound will be penetrating through the internal organs. As the wave interacts with the tissues of varying elastic properties and densities, they generate echoes, which directs back to the transducer. Once the sound waves reach to the transducer, those piezoelectric crystals will become converting these ultrasound waves or the high-frequency pressure waves to the electric signals. It occurs more than 1,000 times in a second. Those electrical signals are translated to form a bright spots into the monitor, which is corresponding to the anatomical organs and the strength of the reflecting echoes. As I said earlier, the transducer consists of extensive array of crystals, which makes a series of image lines that together to form an image frames, which is known as sonogram. Furthermore, all the crystals are activated several times in a row, forming a complete image frame, roughly around 20 frames in a second, displaying a real-time moving image. That's the general idea about the ultrasound scanning systems. The ultrasound scan is cost-effective, harmless, and a good diagnostic value.
Assalamualaikum warahmatullahi wabarakatuh. Good day to all of you. My name is Sophia Hasso. I am a student from Bachelor of Medical Imaging Cohort 9 at KPJUC. And today, I'm here to talk about the angiography. Let's get started. I'm going to start with what is angiography. So, angiography is an imaging test that uses X-ray to view your body's blood vessels. The X-ray provided by an angiography are called angiograms. This test is used to study narrow, blocked, enlarged, or malformed arteries or veins in many parts of your body, including brain, heart, abdomen, and legs. And now, let's move to the indication for the scenario. The best example is coronary angiogram examination that will be conducted at invasive cardiac laboratory in every hospitals. Let's have a look at this video. This machine is used for coronary angiogram to study the coronary artery. So the projection to be done will be first AP cathode to study the left circumflex artery. Spider view, the left anterior oblique cathode for the main stem and bifurcation of left anterior descending and left circumflex artery. Next, AP cranial to study the left anterior descending artery. And lastly, right coronary artery can be assessed by left anterior oblique and AP cranial view. So all these views require an expert cardiac angiographer that is well trained by the lecturer at KPJ Healthcare University College. Thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.
So, I will explain to you about what is nuclear medicine imaging. Okay, so nuclear medicine imaging is one type of the medical specialty involving the application of radioactive substances in the diagnosis and treatment of diseases. So, in sense, this nuclear medicine is also one type of the radiology because it records the radiation emitting from within the body rather than the radiation that is generated by external source like X-ray. In addition, nuclear medicine also differs from the radiology, which is the radiology just emphasizes in the imaging anatomy but not on the function. Therefore, in nuclear medicine imaging, we are focusing or emphasize in the physiological imaging, and one type of the modalities in the nuclear medicine imaging is SPECT, PET-CT, and also gamma camera. SPECT-CT, which is single photon emission computed tomography, is one type of modality which using the gamma rays. So it is very similar to conventional nuclear medicine planar imaging, which are using the gamma camera. But this SPECT machine is able to provide true 3D information. So this information is typically presented as cross-sectional slices through the patient, but they can be freely reformatted or manipulated as we required. We also have a PET-CT, which is positron emission modality. So this PET-CT machine is one type of functional imaging technique which uses the radioactive substances known as radio tracers, which is FDG or 18 fluorine. Right? So these radio tracers is to visualize and measure the changes in metabolic processes. In other words, is also measure the physiological activities, including the blood flow, regional chemical composition, and also absorption. So, depending on what are the radio tracers that we're using, so this FDG is commonly used to detect the cancers and is also widely used for detecting bone formation. And we also have another radio tracers which is oxygen 15 that using for measure the blood flow. Okay, that's all from me. Thank you. Bye.